Imagine this, it's 4 o'clock in the morning and you hear your child yelling from their room. You rush in and you find your child having a hard time breathing. They're coughing, wheezing, and struggling to catch their breath. You reach for their rescue inhaler and administer it to your child, and after a few minutes, they settle back down and drift off to sleep. This is the reality of childhood asthma, also known as pediatric asthma. The American Lung Association states that there are 5.5 million children in the United States alone who suffer from pediatric asthma. And you may be wondering, what exactly does that mean? What is pediatric asthma? How do you treat it? And maybe what the management is. And I plan to go over all of that with you so that you may walk away from this speech with a better understanding of what exactly pediatric asthma is. To start off, Yale defines pediatric asthma as the swelling of the airways that causes inflammation, extra mucus, and a difficulty breathing. For some kids, this can be severe. This can lead to hospitalizations, asthma attacks, and even death. For most children, they are lucky enough that pediatric asthma only inhibits some of their day-to-day functions. For my family, pediatric asthma looks like my son, Christopher. He was diagnosed with asthma when he was only 3 years old after a year-long stint of him coughing so hard he was throwing up. We went from doctor to doctor, trying to figure out what was going on, constantly being told it was just a viral infection. We later found that not to be true, and with the use of multiple different inhalers, we have now managed my son's asthma. But that's not the case for every family. Some treatments include smaller things such as inhalers, medications, allergy medications. Other measures include things such as homeschooling their children, medications, and multiple hospital stays. The pediatric nursing published an article that stated that over 190,000 stays of pediatric patients were due to asthma exacerbations that could have been entirely prevented. So when they say entirely prevented, they mean that with regular use of their regimented medications, children's asthma can become well controlled to the point where they are no longer experiencing symptoms. So that can mean using different types of inhalers such as corticosteroids, bronchodilator inhalers, and also including allergy medications, and you can even include other homeopathic methods such as reducing the allergens in your own home. Some people go to extremes with this and will even move their family to a different state to avoid the allergens that are affecting their child. For my family, we have found that reducing the amount of dust in our home contributes greatly to how well my son does. We also shampoo our carpets regularly because we do have cats and dogs. And we have found that this works quite well for managing my son's asthma. So, how long does it take for asthma to be managed? And that is a great question because it really varies from patient to patient. It depends on how regimented the medications are, if the child is following their asthma action plan, which states how they're treating their asthma and what to do if asthma becomes uncontrollable. But for most kids, they tend to manage their asthma over time with the use of chronic steroids, so with the use of an inhaler. The Pediatric Allergy and Immunology Association shares many different resources and medications used to help children manage their asthma. There is this misconception though that kids grow out of asthma, and as a mom who has a child with asthma, I hear this all too often. And the honest truth is children don't grow out of asthma. They simply manage their diagnosis. And they do that with using their medications regularly and appropriately. It's important to treat asthma when it's needed. There are some people in the world that choose not to use like a bronchodilator in public in fear of embarrassing their child, and every time that a child does not receive the medications that they need, it enhances their asthma even further. So it's important to treat asthma every single time it needs to be treated so that you can later manage it better and hopefully get to that stage where children are considered well controlled and grown out of it. There are many resources for families that may be struggling to understand what exactly childhood asthma is, or for people who are willing to learn a little bit more so that they have a better understanding of what exactly pediatric asthma is. Some of those resources include the American Lung Association, the Pediatric Allergy and Immunology Association, and even the Yale University. It's important to understand how it's treated and managed, because at the end of the day, awareness is key. Awareness is what's going to lead further research into this topic and help support families who are dealing with pediatric asthma every day. And honestly, pediatric asthma may be affecting somebody close to you. So it's always best to share a little bit of knowledge so that when you do come face to face with this diagnosis, you have a good understanding.